We hope you enjoyed video number 1, and now we're going to move on to Dr. Martha's treatment plan and what that looks like on her end. So why don't you tell us, what are the main pillars on how you work with your clients and what kind of steps you go through?
Yeah, thank you very much. So I just like many practitioners, I will do a sex history first. And a lot of them would have primary vaginismus. A lot of them are virgins. And so I still needed to ask them questions around their comfort level when it comes to being naked, their understanding of the sexual anatomy, their comfort with being with their partner, and what are the sexual activities that they're comfortable with, whether they understand what is orgasm, whether they have ever had an orgasm, what are the ways they have an orgasm. So basically a sex history. And then from there, I will be able to personalize, customize the information that I give them. And a lot of times it's very dynamic. What I've found over the years is that it doesn't matter that I know everything and I have a structure and a program and I have like things that I want to say. I have to first answer what is the most pressing question in their head, because unless that question is answered, they are not willing to move on, or they are not ready to move on to the next thing. So it's much easier and much better to meet them where they're at and to be answering all the commonly asked questions, including where's the hymen, and will they have blood during the first time of penetration, like a lot of what we assume should be common knowledge still is quite confusing for a lot of people, because there are all kinds of articles and hearsay. And so part of it is to educate them about all the things that they have in their head. So after that, when they are really asking me what actually how to overcome vaginismus. So a lot of literature will say this, which is progressive steps. So yet a lot of places don't talk about what to do when you talk about progressive, and then you immediately start talking about like inserting something small. And there are people who are not ready to even insert something small because they have other concerns, such as the fear of pain. So being able to demystify the pain and the sensation in the vagina is also part of taking small steps. So instead of telling them, okay, so this is a little bit like what I would say. I'm just kind of like recurring from memory. So I'll say it's very difficult to insert a penis if it's difficult for us to say insert something small, like the girth of a finger, say a finger, or something that is equivalent of a finger or even smaller than a finger. So instead of something big, something smaller first, and it is difficult to insert something small if we are not even comfortable with something just touching the entrance of the vagina. And it's difficult to touch the entrance of the vagina when we don't know where is the vagina or the entrance to the vagina. And so in order to be able to be comfortable to identify and to touch the entrance of the vagina, being able to understand the anatomy. So looking at the genitals, touching, naming, exploring, all smaller parts of becoming more comfortable with the idea of penetration. So for them to even explore the entrance of the vagina and the range of sensation possible, and then to demystify the sensation with penetration. A lot of people get really overwhelmed that there's so much sensation at the entrance, without understanding that the entrance of the vagina is full of nerve endings and is meant to be full of sensation as a way to protect us biologically. And so one of the big misconceptions is that it's going to be more and more painful because I'm feeling a lot of sensation. So being able to give anatomically accurate information, such as the vagina is the most sensitive at the first 1/3, and the structure internally, and the best angle to do inserting or self-exploration, and to use something smaller, for instance, like a cotton bud. Like these are all little instructions that helps them to better understand the small steps. So when, let's say if they are uncomfortable with touching even the entrance of their vagina because they have never really explored themselves, they might want to use a mirror and then just touch. And then over time, be comfortable to touch themselves without using the mirror. And once they're comfortable to do that, being able to just tease the entrance of the vagina without the expectation and the pressure of needing to force anything in. So these are small steps that I start to teach them. Yeah, so I have a lot more that I can go on and on about. Yeah, so some of them are not even comfortable with their genitals being touched. They don't touch their own genitals. So most people, they are comfortable with washing themselves. When it comes to their partner touching them, they may feel that they are not ready to do this because they haven't felt that they know their partner in this context. So one of the things that I suggest is being comfortable to do exploration with the partner over underwear first, and then setting clear boundaries of, in this session, you do not do anything more than what we did with over the underwear. So then they do it without underwear. And then they play with teasing the entrance of the vagina with finger, for instance. And the whole part about communication is a big part of them building trust as a couple. That when I say stop, you will stop. And there's no shaming, there's no blaming, and no eye rolling or any kind of passive aggressive kind of behavior. So all these are small steps towards the partner being involved with those exercises. Yeah, so these are just some of the things that I teach.
Beautiful. I love that. Thanks for sharing the details on there. And you mentioned that your personal experiences with having your own sexual debut in life, what we tend to call in society losing our virginity, had a lot to do with how you actually approach the situation with clients. Would you like to tell us more about that?
Yes, thank you so much for asking. Yeah, so I don't usually share this publicly, but this is exactly what me and my partner did. He first, we did a lot of foreplay with underwear, and then without underwear. And then he started teasing the entrance of the vagina, and I was really scared that he would just shove the finger in. And because he promised, and because I was holding onto his hand, and over time I started to relax, that I developed this concept of what I call say do, because that was exactly what my partner did. He would say what I was going to do, and then he would do it. He would never do anything without telling me first. Because what happens is our genitals are down there and our eyes are up here. So when we have things being done to us and we can feel it, but we can't see it, that also adds to our fear. So my partner was really good in, from the beginning, telling me that I want to do this. Is this okay? Can I do this? Is this okay? So that was like one of the most empowering times of my life, because every step of the way he would tell me and then or ask me, and then we would do it. And there would be times that we would try something and it can feel like the sensation is too overwhelming, and I'll say stop, and he would stop, and then he would say, do you mean stop, like stop the session, or do you mean like stop for now inside your vagina, like take a break, and or do you mean like take a break externally? And so from there, let's say we take a break, from there he would encourage me to try another time. So each session we would try, wherever is my limit, we'll try it 2 or 3 times before we stop. And that is, I feel, the biggest thing. Most of my clients, they would spend a lot of time getting aroused, and then they will go for it. And when it kind of like doesn't work the way that they expected, like it's not smooth, or there's pain or discomfort, and the person with the vagina says stop, then what happens is they just they just close shop, and then they just get upset with each other that today is not the day. So they seem to assume that first time sex is meant to be the way porn is, which is you're aroused and then everything just happens. So what my partner did was every time I was uncomfortable, he would stop, and then we'll try again, and then we'll stop. We were aroused again. So basically we would do what I call a Matter's formula, which is 2 or 3 cycles of arousal. So he would arouse me, and then we would do inserting. Then I'll feel pain, discomfort, we'll stop, we'll rest for a while, and then we'll try a second round. So a lot of my clients would stop after 1 round. They will stop after arouse, insert, and then doesn't work, and then stop. So what happens when my partner did arouse, insert, rest for a while, and then try a second round, and sometimes we try a third round, what happens is the body has the opportunity to absorb the pain. The body has an opportunity to not do the freak out, and the body has a chance to kind of like warm up a little bit and then go for it. And it is very important because as a virgin, for most of my clients who have primary vaginismus, who has never had anything go into the vagina, is that the vagina is very sensitive. And if your vagina has not been stimulated before, you will feel aching and slight discomfort. You will feel sore very quickly. And so the whole point of it is to be very gentle. So this is exactly what happened when I was a virgin. And this was exactly what me and my partner did. So when I started to work with clients with vaginismus, and I couldn't find anything that was really useful, to be very honest. I looked through periodicals, I looked through vaginismus books, and they were all just talking about progressive steps. They were all talking about here are the dilators. And it wasn't, it's not what you do, it's not what you use, it's how you use it. And my partner did it in a very gentle, very consenting, very loving way. And so it was really a little bit of like a no expectation. Yes, our expectation was every session, maybe we go a little bit further, but our expectation wasn't today, you'll be ready and then I will penetrate you with my penis. It was never like that. And so yeah, so the day I was able to progressively, slowly, stop start many times, finally, after 1 month of practice, for some of my clients, it's 1 month. For some of my clients, it's longer. For some of them, it's faster. For me, it was 1 month for the entire finger, stop, start, and several sessions to be able to be inserted fully. I thought he would want to go on to 2 fingers, if we've graduated from 1 finger, so now maybe we'll want to go on to the second finger. But instead, what he said was, if 1 finger is not easy and not smooth, then we don't go on to the second finger. And so we kept practicing with 1 until 1 was very easy and quick. And I was completely fearless because there was no pain. And then we went on to 2. So it's really not about rushing it, the whole process. Of course, arousal is very important. So I came up with this thing I call the seesaw. When you have more arousal, you have less pain. There is still some discomfort as a virgin and somebody who is not used to being stimulated internally. And over time, the muscles actually got stronger and I became less sensitive and I was not scared, and the actual discomfort and the pain wasn't also unbearable. And that was how me and my partner were able to overcome this progressively. So because there was not much literature out there that was useful, so this was the reason why I started to share my virginity story with clients, and I started to encourage them to try Martha's Way. And I was very surprised at first, but now not surprised anymore, that actually a lot of them were able to overcome their condition vaginismus relatively quickly. So I have had clients who overcome vaginismus in 1 session, quite a number actually, some in 2 sessions. And a lot of them, they take what they learn and they practice, and sometimes they will come back to me like in months and all that, and update me. And a lot of times when they come back to me, a lot of times it's actually because they are not wanting to follow Martha's method, and so they are struggling with it because they they are not willing or not able or misunderstood what I'm saying. So this is when they come back, and then I actually give them more information, more knowledge, more resources. So it is a journey, it's a process. And that's actually a lot of stress on me, because I do want to help them to overcome their condition as quickly as possible. And yet at the same time, it's a bit of kind of like a energetic thing, you know, like are they willing to spend more time with themselves, for themselves as well.
Yeah, very well said. And I think it's beautiful that the perfect partner came into your life with that sort of introduction into sex that worked really well for you. And it really allowed you to take your time and to see where your limits are and to get comfortable.
Yes.
I think really the perfect people do enter our lives at the perfect time.
Yes.
And that you were able to communicate when you were in discomfort and in pain. Because for so many of us, this is a piece that we've never learned in our life, to be able to set boundaries and communicate when we're not feeling 100%, when there's pain there, because we try to push through it. So it's fantastic that you spoke up and you knew when to stop.
Yes, my partner was really loving, really patient through the entire process. Never once did he ever scold me or snap at me or shame me. He was always encouraging and compassionate and kind and gentle and encouraging. So I was very, very, very fortunate. I know this now because I hear so many stories from not vaginismus clients, but also people who don't have vaginismus, whose introduction to sex is not good, it's not great. And there's a lot of blaming and a lot of comparing and self-judgment. So I was very, very fortunate. And it was actually because of having had such an empowering and wonderful first-time sex experience that made me become the person that I am, that made me comfortable and confident in my sexuality. And I think that is a big reason why I'm very different from my friends. My friends who don't like sex, are afraid of sex, who hate sex, who have low sex drive. It's because their introduction to sex wasn't great and scared them a lot. I didn't have a lot of sex education growing up. I didn't become a sexologist early in my life. And when I was first exposed to sex and started to engage in sexual play, I had never read a sex book. I didn't have sex education classes in school. And so a lot of it was just through trial and error and through experimentation and not understanding what was really happening to my body, knowledge that I wish I had so that I would have a lot of the questions answered rather than like be too embarrassed to ask this to my partner because I just didn't want to appear stupid. And so yeah, I think if not for my my partner, I don't think I would have become a sexologist, because I started to see how important sex is as part of my identity and happiness. And it is a big part, I feel, of a relationship. And so when I saw all my friends around me struggling, I realized that I didn't want this for women. And I thought, if so many of my friends who are women have sexual difficulties, perhaps there must be many other people that I can help. And so my impetus really to become a sexologist was actually to help women. And then because of all the knowledge that I have, I realized that it's not fair to say that I only want to work with women when actually I have the knowledge and the training and the skills to also be able to support men as well, because a lot of men and women, they need support just as much. And so yeah, I'm very happy to be able to have such diversity in the training that I and the kind of profile of clients that I have. So I work with all kinds of sexuality challenges, for people with penises, like premature ejaculation, erectile difficulties, delayed ejaculation, low sex drive. So it's really wonderful to be able to support people and to see how their faces light up when they get knowledge, and they feel a lot more confident. To have the answers to their questions is very, very important, because knowledge is really power.
Yeah, beautifully said. Well, thank you so much for sharing your
Thank you.
story and your treatment plan.
Yes, thanks for doing this video.